So my session basically is we're going to touch upon what chronic conditions and how exercise can be beneficial, national guidelines and recommendations, and then we are going to look at heart failure and the evidence for exercise in heart failure. But I will then just highlight the important part of it as to how we deliver the exercise for patients with cardiac problems, including heart failure. And obviously the importance and the need for a qualified, specialized professional in this particular specialty to deliver the safe mode of exercise and progress the patient. I have a brief case study as well about management of a chronic heart failure patient in a community, and then we are fortunate enough to have the patient here too, who will briefly tell us about his own experience. So, one of the parts that Dr. Bethel was talking about is the expert, the MDT care in the community and involving people, patients with first-hand experience themselves. So, we're lucky enough to have somebody here who is going to be sharing their experience on it. So, just quickly, when we talk about chronic long-term conditions, according to the International Classification in Primary Care, what do we call chronic? It's basically looking at the duration, and the general consensus is 6 months or longer. The pattern of chronicity is it's not something that is curable, or it has the pattern of remission and relapses, and prognosis may not be as something that can be cured. It can be progressive, or it's something like somebody has to manage that condition themselves. It's more of a management issue. And of course, being a chronic condition, it will have its sequelae. So it would affect the other systems in the body, and it can lead to a vicious circle. So we are looking at managing, controlling the condition by medication and other therapies or treatment. This is where the biopsychosocial approach comes into play. Now, we're obviously looking at the person as a whole, his medical issues, what his body is telling him. The condition, underlying problem is there. So we're looking at the lifestyle, the diet, sleep pattern, any form of regular physical activity or exercise, and avoiding the negative aspects like the sugar, nicotine, alcohol. We can add a lot more to that list. How the